name is Chris Allphin. I'm a board-certified OBGYN for Monarch Healthcare in Idaho Falls, Idaho. Let's talk about delivery. First of all, unlike Hollywood, delivery and labor is a slow process. Oftentimes, it can take a centimeter an hour to dilate. So labor can take 10, 12, hopefully not, but sometimes 24 hours to go through all the steps of labor. During this time, please have open communication with your provider. If at any time you're uncomfortable with the process, don't be afraid to ask your provider what's going on. Ask him or her to explain to you the process so that you can better prepare for when this baby comes. There are two essential ways to deliver. One, you go into labor on your own. This is my preferred way. But sometimes our patience runs out. The due date comes and goes, labor doesn't happen. If that happens, maybe we should talk about an induction. If you're electively choosing induction, it is recommended that you do so after 39 weeks, as we have found that NICU admissions decrease if we're delivering after this time. Now, just because we can doesn't mean we should. If your body is not prepared for delivery, I recommend you wait at least till your due date, if not a week longer, as to allow your body time to prepare for delivery. This is where a lot of the horror stories of induction come. 48-hour inductions, 72-hour inductions. These happen because your body most likely wasn't ready for induction, and you would have benefited from another week of pregnancy. Hopefully, labor goes great. Hopefully the baby's head is down. If, however, there are hiccups along the way, labor doesn't go well, or if the baby is not head down, we may need to talk about a cesarean section. This is a small 10 to 14 centimeter incision in your hairline. Usually recovery is a little bit longer from a normal delivery. Plan on spending an extra day in the hospital. But the process for cesarean section has been streamlined, and hopefully this surgery goes incredibly well for you, and your baby will be taken care of well. Congratulations, you've had a baby. You will spend a couple days in the hospital and then make a 6-week postpartum visit to see your doctor. During the next 6 weeks after delivery, you can expect bleeding and cramping as your uterus gets back to a normal size. During your 6-week postpartum visit, you're going to cover topics such as postpartum depression, birth control methods, and how you're generally doing with the baby. This is also a time, if it hasn't been done, to do a vaginal exam to make sure that you've fully healed from your vaginal delivery. Again, congratulations. Have fun with your baby and enjoy each phase of life. Now the fun begins.